Assalamu alaikum. My name is Khaiba Fatma and my roll number is BP 1450093 and my topic is Neostigmine. Neostigmine belongs to the cholinergic muscle stimulant class. It is choline stress inhibitor used in the treatment of myasthenia gravis and to reverse the effects of muscle relaxants such as galamine and tuberculin. Pharmacokinetic feature. It is carbamide quaternary amine. It has poor liquid solubility, orally active. Duration of action is 30 minutes to 2 hours or more. Contraindication and side effects. Contraindication. Absolute contraindication of neostigmine includes hypersensitivity to neostigmine, peritonitis, or mechanical obstruction of the intestine or urinary tract. Side effects. Common side effects of neostigmine methyl sulfate are increased mucus, muscle twitching, bowel or abdominal cramps. Dose requirement for optimal results vary from 15 mg to 375 mg per day. Mechanism of action. Inhibit the hydrolysis of acetylcholine by competing with acetylcholine for attachment to acetylcholine esterase at sites of cholinergic transmission. It enhances cholinergic action by facilitating the transmission of impulse across neuromuscular junctions. Dose adjustment. Acute dose 0.5 to 2.5 mg IV/IM. Maintenance 15 to 37 mg per day. Use injectable with 0.6 to 1 mg atropine IV to counteract muscarinic effect. Drug toxicity. Increased parasympathetic effects, especially nausea, vomiting and diarrhea. Irrational use. Irrational use of neostigmine may lead to toxicity that cause severe effects like decreased pupil size, increased urination. Alternate brands of neostigmine are Bimine injection, Mysoline, and Prostigmine. Now here we discuss case study. Case study. Our patient was a 74-year-old Iranian male who presented to the acute geriatric department with vomiting and abdominal distension of 1 day's duration. His vomitus was coffee ground in color, non-bilious, and associated with watery diarrhea. The abdominal distension was of sudden onset and was progressive in nature. He also reported a low-grade fever for 1 day. The responsible consultant undertook a comprehensive geriatric assessment on the day of admission. The patient was an elderly male of stated age who was not bedridden, took oral feeds, and didn't have an indwelling catheter. His body mass index was 27.4 kg per mass square. There was no evidence of dry skin or pressure source. Subjective. Gender male, age 74 years, history acute geriatric department with vomiting and abdominal distension of 1 day's duration. Body mass index was 27.4 kg per mass square and low grade fever. Object. Patient diagnosed with ACPO referred to as August syndrome characterized by chronic distension in the absence of mechanical obstruction. Assessment. We made a diagnosis of ACPO and decided to manage him conservatively with a combination of the bowel rest, nasogastric tube decompression, and rectal tube placement. We made the diagnosis of ACPO and decided to manage him conservatively with a combination of bowel rest, nasogastric tube decompression, and a rectal tube placement. We also monitored his abdominal breath routinely. The initial measure was 140 cm. We monitored his electrolytes regularly and picked up hyperkalemia. On the third day, this was deemed secondary to diarrhea and vomiting as his initial potassium was normal. Thank you.